Hey everybody, welcome to the show. Micah with CoronavirusDiaries, and today I'm fortunate enough to be able to speak with Gabrielle Arrowsmith, a health unit coordinator at a hospital here in the Twin Cities. Gabrielle, thanks for joining us. Really quick for the viewer, for the listener, could you just explain who you are and what it is that you do?
Yeah, so my name is Gabrielle, and I work full-time at a pediatric hospital in the Twin Cities as a health unit coordinator in radiology. So things have been kind of changing in our area, and we've been seeing a reduction in patient needs. So a lot of interesting changes. And then I also work part-time as a substitute teacher, which is no longer occurring amid Corona. And then I also work in the film industry as a writer and actress.
That's outstanding. The unfortunate thing that I am noticing is that even though you had these parallel tracks of things that you enjoyed doing or that were bringing in income, it seems that all three, per our discussion just before this, even with the healthcare stuff, it sounds like they're all being impacted potentially significantly. Do you mind? So what's happening with the hospital? You had mentioned a furlough. Can you
Yes.
explain what that is and why it's happening?
Yeah, so a furlough is basically the same as a layoff, other than the fact that your benefits will be paid while you are not employed with the hospital. And you, as of right now, they're saying we are guaranteed to get our job back after the period of furlough. So we're looking at a furlough of about 4 months, running May through April, or
Wow.
sorry, May through August.
So is that only for the pediatric unit? Are they doing it for a number of different units throughout the hospital? How did they roll it out, or how have they
Sure.
been presenting it to you?
Yeah, so basically our management came up with numbers that they needed. So in this case, it was 225 full-time employees that needed to be furloughed for this period of time so that they weren't going to be paying us, but that we would be being paid through unemployment insurance instead. And then they kind of looked at numbers in different areas of the hospital, different units, patient numbers to see which units were the lowest need right now. And then within those units, they left it up to the managers and supervisors to determine which of, like you guys need to lay off 5 individuals, you guys need to
Wow.
lay off or furlough 7, and then left it up to the managers to decide who those people were going to be.
What exactly do you do in the pediatric unit? Is it only babies, or do you work with the mothers for their own? I'm not too familiar with pediatrics.
Sure. Yeah. So we see patients from birth to 18 years typically.
Wow.
Sometimes we go up to 21 years. In the current state, we are seeing patients up to 25 years of age, just because all of our care physicians, radiologists are experts in pediatrics, but a 25-year-old's body is very similar to an 18-year-old's body. So to try to relieve some of the stress on other hospital systems, we've taken on some non-COVID patients up to age 25.
Sure.
Um, yeah, and we do actually see mothers for fetal imaging sometimes in my area. I'm in radiology,
Yeah.
so we do scans on babies who need to be sedated, typically with ventilators, which we no longer have. Those kinds of things.
Really? So they shifted all the ventilators over to another unit?
Yeah, most likely another hospital. I guess I haven't received the exact information as to where all of our ventilators went, but one of the first
Ah,
steps that we took as an organization was to reduce the number of surgeries that we were doing. So only the highest need patients were receiving their surgeries, basically if it was life threatening to that child. Everything
wow.
else has been deterred.
Okay. So with your location, is it kind of determined that your location will not be housing COVID patients? Or did the city set up specific locations where they're going to push, COVID
Yes,
patients?
yes, they
Yeah.
did. So there are 3 hospitals. There are 3 pediatric hospitals that are seeing patients with suspected COVID. The hospital that I work at is one of those 3. So we do see patients with who have tested positive or are suspected to have COVID.
Wow. In Minnesota right now, we're still under, I mean, the testing is kind of hit and miss because it's just depends on how many tests are available and how many tests are pushed out. I haven't really been paying too much attention to the testing as much as I have the fatalities. Minnesota is under 100 as of the reporting of this. What's the general sentiment for you or you and your coworkers around COVID, like it's shutting down businesses and being furloughed.
Right. I think there's a definite anxiety and just fear on a personal level for everyone coming to work each day. We have seen the shortages of PPE. We are using the same procedural mask, so not the more effective N95s, but just a simple procedural mask that we're asked to put into a bag at the end of our shift every day.
Wow.
And reuse unless it is wet and becomes soiled in any way and then is no longer effective. So things like that are causing anxiety, like, do I have protection for myself? There's always miscommunications as far as like from a patient coming from a clinic to the hospital who's been referred. Have they done the pre-screening questionnaire? Are they safe to be coming into our area without a mask?
Right.
So at one time I was under the assumption that all of the patients who would have suspected COVID would head straight to our emergency department. We had a little area built up around there for isolating those patients.
Sure.
And kind of dividing them into respiratory concerns and non-respiratory concerns. And then I asked my supervisor, it kind of went up through a phone call chain of trying to find out the correct answer to this question. And it came back that we would in fact see patients in our area in radiology as outpatients who may have COVID-19 or who have been exposed to it or are suspected positive. So then there was the question of, well, now if I'm, in direct patient care, I don't have the proper PPE to be, checking this patient in and getting them ready for their tests.
Incredible. Are they providing, or is there some form of a stockpile aside from those surgical procedural masks? I mean, face shields I've been hearing is a big thing. The gowns, is that reserved only for the people that are dealing with, incubating, or what is it called, intubating and all that kind of?
Right. Yes. Yeah. Yep. The more extensive PPE is definitely reserved for the patients or for the care team rather, who are working directly with confirmed positive patients. But as an organization, we have been working to receive donations. So we've gotten a lot of cloth masks from the community to give to our patients' parents, as well as some of our staffs who are in non-patient facing roles. And then we also have had redeployment opportunities for staff members who are in low needs areas who have been asked not to work. They can sign up to be redeployed. And one of the redeployment opportunities was to make face shields. So a lot of staff, instead of, scheduling, they're now making face shields and distributing those throughout the hospital.
Betty the Riveter, right?
Yeah, exactly.
Kind of just fill the roles that are necessary. That's incredible. Wow. It's just, it's such a bizarre kind of happening where, a month ago, we were hearing these numbers come out from the government, that the models that they're running that was pushing like massive casualties, so to speak. And now we're still sitting under 100 in Minnesota, a state of like 5.6 million people. And it's tough to weigh out this decision for like, lost businesses and people losing their jobs or being furloughed. Are you familiar with unemployment? Are you able to apply for unemployment on furlough? Do you know?
Yes. If or when I am furloughed, I am the least senior of 3 people working in the same area, and one of the 3 of us will be furloughed this coming Wednesday. So I'm assuming it's going to be me, but things could change.
Yeah.
I will be able to apply for unemployment insurance at that time, and I will still receive benefits. So that's good to know.
I mean, the best of a worst case scenario, I guess, in
Right.
the event that it does happen.
Well, and another thing to consider is my organization, in effort to make sure that they have a future, because we are not seeing as many patients as we are used to in the pediatric setting. They've been losing a lot of money and they're concerned about that income. So they're actually cutting wages for all of the people who will not be furloughed.
Wow.
So everybody's taking like a 10% pay cut. Supervisors and managers, 15%, senior management, CEOs, vice presidents, those kinds of folks are taking a 20% pay cut. So in some ways it might, being furloughed may not be the worst option, because if I were still working, I would be having both my hours and my wage cut. So
unprecedented times, that's for sure.
Exactly. Yeah.
Wow. And then, kind of a segue to the teaching.
Sure.
So that was basically what, that was 4 weeks ago, about that the state
Yes.
did all the students went home, schools closed down. Have they talked to you at all about what's happening with schooling and how, like, what's going on there going into the summer?
Yeah, it's just distance learning for now. I don't believe that there are, I don't believe that most school districts have been able to officially say whether or not students will return to school at some point this year. I think it's just a day-to-day thing. I
Sure.
haven't been receiving a ton of communication from the school district just because I'm just a substitute teacher, not a salaried or contract teacher.
Okay.
So I don't receive that communication. So for me, it was just one day I was able to work part-time as I typically have, and the next day that was completely gone.
Sure.
Yeah.
Oh man. So right now you're standby for the teaching,
Hmm.
standby
Yes.
to find out what's going on with the furlough. The
Hmm.
reason that we had met way back was from film and from doing some production work. You mentioned that recently you had done some stuff. You mind sharing a little bit of that?
Totally, yeah. So this past winter, I was working on a short film that I was the producer for. It was just a weekend shoot, but we had spent months and months and months preparing, and it turned out to be a really good project. Afterward, having spent as much time as I did of growing into the producer role, because it's something I hadn't done a lot before, I just needed a bit of a break for myself. So I'd done a little bit of acting things, auditions. I think I had a tiny bit of work through agencies, but I haven't done a ton of acting for a period, just to kind of take a little hiatus for myself. And now I don't really have the option to do it anymore. So I'm kind of missing it, although I have been able to start connecting with some folks who are trying to keep their skills fresh during this time, and are meeting through platforms like this and being able to just practice and yeah, do table reads and things like that for future production. So hopefully that'll open back up sometime soon.
Very cool. What about production? So it's difficult, really difficult. It's always like it's working against you. What about production, whether it's the acting side of things or the producing, directing? What do you enjoy about it? Like what about it is so
Sure.
enticing for you?
I love the challenge on an individual level, but then I love working with others and collaborating and seeing what you can make. I mean, I guess the outcome is really what keeps you going. Learning new things, the learning process is always really enjoyable, and then seeing what you can make when you all come together and put things aside and work together to get it done.
You have the big team project. Did you have anything you were trying to go into here during the spring summer that was cut short, or were you just taking time to kind of
I was I
disconnect?
Yeah, I was just taking time. I guess I can't think of any projects that I had lined up that are no longer being produced. But I have, being part of the community, I definitely know there are a lot of people who are pretty frustrated
Yeah,
because they were either in a show or in a film, and they were gearing up for that production phase or that show phase, and then everything suddenly canceled. And a lot of things, unfortunately, because you lose locations and that, a lot of things know whether or not they're going to be able to pick back up in the fall.
yeah. But the one that you worked on over the winter, was that with Z Fest?
No, that was separate from ZFest.
Okay.
Yeah.
And what was the name of the project?
It's called Aperture,
Okay.
and it is a short film based on a feature-length screenplay written and directed by Joe Monahan.
Standing, and that's available online somewhere?
Not yet. No, I
Yeah.
believe it's still in the post-production phase. That's one benefit that I feel like a lot of people in the film industry might be finding right now during this time, is they suddenly have more time to sit and edit things and
Yeah.
perfect, the post-production phase of their craft.
I think you're a prime example of many of the people that I know that are in production, in
Mm.
that you have to be doing multiple things in order to basically finance that
Yeah.
passion, because it is a significant undertaking. Um,
Hmm.
but it'll definitely be interesting to see kind of how things progress and move into the summers in terms of the production stuff and connecting with other people. to kind of keep skills fresh. Have you been in any discussions, or are you facilitating any ideas on how to produce something while you're behind closed doors, like in this collective type of environment?
I haven't taken on the producer role for anything, but there are two different film projects, feature film projects that I'm working with others on right now in the acting role. And I do think there's a possibility, just because people are unable to physically get together right now, I do think there is a possibility that the folks who are producing it might need some extra help and may, ask me to help fill that role in some ways, which I think is possible right now as far as some of the prep you do, like finding insurance and looking for locations, but the funding is going to be tough for
Yeah,
everybody right now.
yeah. Can only imagine. It's a lot of things are changing for a lot of people really rapidly, but
Mhm.
well, I know you are a very busy woman, and we are reaching that time. Was there anything that you would like to share or discuss before I let you go?
No, I mean, I think it's just the same for everybody. You have to do your best right now to to stay positive, find the silver lining in all of this, and take the time to connect with, people that you maybe haven't had time for before, because now we all suddenly have more time on our hands in most cases. And
Silver lining, right?
right, exactly.
Outstanding. Well, Gabrielle, thank you so much for being on the show. I look forward to connecting with you again here in the near future. For all the viewers and listeners, stick around. We have more coming at you soon.
Thank you.